I think I've witnessed the death and dying of many people who have all sorts of different views about humanity, about God, about what happens after you die. So on the one hand, I've witnessed my patients who have a completely humanist, death is the end, there's nothing beyond, but who have prepared well, with their family and friends. They've expressed their wishes, they've said what needs to be said, and, fade away in the what I believe is the mistaken belief that that death is the end and there's nothing beyond. And then I've also seen patients of mine with a strong Christian faith who have followed Jesus, for many years, and are preparing for death because they're looking forward to meeting their Saviour and to be welcomed into the next life.
Dr. Tony, thank you so much for coming and for being willing to talk about assisted dying, a subject that's very much in the news at the moment. People are talking about it. There's all kinds of speculation. But as a retired GP, you probably have more to say to this subject than someone like me. So if it's okay, I'll just put some questions on the table and see how we're led. So firstly, isn't dying well a contradiction in terms?
Yes, it does sound like it, doesn't it? Where we, particularly in our UK or European culture, we don't really associate dying with anything particularly positive. Death and dying on the whole is considered to be a rather negative situation. People lose their loved ones, here 1 minute, gone the next. So that sense of loss tends to be mourned, obviously, and it can be very difficult to regard death in any kind of positive way. Dying well refers mostly to the preparation and process of someone who has come to terms, with the fact that their illness or their disability is irreversible and that the inevitable is going to happen. And rather than going into denial, a person has the opportunity to prepare, and dying well could involve not only the individual who's coming to the end of life, but also their friends and family. A good death, if you like, can be something that people are left with as a positive experience, not only the sense of loss.
Why do you think it is, as a society, we've sort of made death a very clinical thing and pushed it into the shadows? Why are we afraid of it, do you think?
Well, I think it probably stems mostly from, if you like, sort of the modernist view, if you like, of health and sickness, where we've got to the point of being able to treat, maybe not cure everything, but being able to treat pretty much any illness or injury or health problem that threatens life, and that healthcare it extends, all the way through. Whatever your age, whatever your illness, it's possible to do something, to help or to prolong life or to relieve symptoms. And it's a brave patient who says to his doctor, "I don't want any more treatment. Leave me alone." It seems that patients are kind of caught up in a system where the philosophy is do everything, have heroic treatment, even though it may not be pleasant. And so there's this sort of mindset of we can't accept that Uncle Joe or Granny is going to die. We have to do all we can to put that off as long as possible. So because healthcare is involved so intimately. That's probably why the sort of deathbed scenes, if you like, you might have seen maybe in earlier in the 20th or even in the 19th centuries are relatively rare, because everything happens in hospitals or care homes or hospices.
How can someone prepare for their death?
Well, a lot of preparation rather depends on your worldview. I think I've witnessed the death and dying of many people who have all sorts of different views about humanity, about God, about what happens after you die. So on the one hand, I've witnessed my patients who have a completely humanist, death is the end, there's nothing beyond, but who have prepared well, with their family and friends. They've expressed their wishes, they've said what needs to be said, and fade away in the what I believe is the mistaken belief that that death is the end and there's nothing beyond. And then I've also seen patients of mine with a strong Christian faith who have followed Jesus, for many years, and are preparing for death because they're looking forward to meeting their Saviour and to be welcomed into the next life. But on the other hand, I've seen people who have all kinds of different personal beliefs struggle, with the dying process, or struggle with difficult relationships in the family, which then kind of distract from preparing, to die well. So it's a minefield, really.
Wow. How did you as a GP deal with that yourself when you're wanting to bring comfort, but very complicated dynamics? How did you manage that?
Yeah. I think for me, it's a great privilege to be able to spend time with people, particularly in their own home. Hospital doctors don't really do home visits, but as a GP in the community, I have access to. I used to think of having 10,000 beds. You talk about a hospital with a few hundred, but I had 10,000 beds. They were all, slept in every night. But some of them turned into deathbeds, I suppose. But to be able to visit someone at home and to give time, make and give time, to listen and to answer questions and to support the family. Often the negative feelings and the anger, often they have their roots in, not wanting, not being in control and not wanting the loved one to go. And so trying to navigate, some of the backbiting and the arguments, and to try to bring a sort of hang on a minute, let's focus on this person. So being sort of person-centered and understanding the dynamics, but bringing a peaceful and positive, kind of atmosphere, I felt was part of my role.
Unlike most of society, you sounds like you were around death quite a lot. In order to survive, did you ever shut down a part of yourself, or were you able to always remain sort of, can I put it, giving?
Yeah, giving. Yeah, no, I think I think I was always there. I wasn't always there at the point of death. That only happened, maybe 20 times, say, in 30 years. But and that's special, and I don't think I ever pulled back emotionally from that. I felt that was a privilege, really. But in terms of being a professional, end of life care for me was a challenge, but a challenge to rise to, and a set of problems to be considered and solved. So my professional job was to do with relationship management and problem solving. And yes, it's sad, when someone comes to the end of their life, especially someone who I've known or worked with for many years. But I don't think I ever lost the human side.
No.
I think it's a privilege to be there, and although it's sad, I don't think, and although I felt the sadness and the loss, I felt I was able to somehow, maybe with God's help, to process that in a healthy way.
And maybe it's your faith has enabled you to do that, because I might be wrong, but I've met medical people who seem very non-personable, non-accessible, emotionally shut down, and not at all available to you. They're just really dealing with a problem rather than a person. So it's great that your faith has enabled you to walk that line. But thank you so much for sharing those insights. Thank you.
Pleasure.